So I will call the meeting to order. Let's start off by invocation. Mr. Tippin, would you help us on that, please?
Will you join me in prayer, please? Lord above, we thank you for today and for our time here together. We ask for your guidance and your direction as we look to make wise choices for those in need. That you give us your patience and understanding and your wisdom. We ask you bless our hospital, our patients, our staff, and most of all our families. In your name we pray. Amen.
Amen. Thank you.
Amen.
And also our mission, vision, and values. I'd like to read that for us right now. Medical Center Health System is a community-based teaching organization dedicated to providing high-quality and affordable health care to improve the health and wellness of all residents of the Permian Basin. And our vision, MCHS will be the premier source for health and wellness. And our values, I for integrity, C for customer-centered, A for accountability, R for respect, E for excellence. I care. Oh, we're going to do a roll call. Start off with roll call. Mary Lou Anderson. Brent
Here.
David Dunn.
Here.
Don Hallmark here. Richard Herrera. Ben Quiros.
Here.
So we still haven't got Richard? Okay. We're going to go forward, y'all.
Wallace Dunn is here.
Oh, and Wallace Dunn. Did I not say Wallace? I'm sorry, Wallace.
Dang, we almost got by with it. Almost.
Sorry about that. Okay, next is our board officers' elections and appointments. We'll start with, just like always, with president for nominations.
I'll nominate Don Hallmark for president.
Is that Ben?
Yep.
Thank you,
David
Ben.
Dunn seconded it.
Anyone else?
None of us want it.
All in favor, Don Hallmark, roll call. Mary Lou Anderson?
Yes.
Brent Dodd?
Aye.
David Dunn?
Aye.
Wallace Dunn?
Aye.
Don Hallmark, aye. Richard Herrera? And Ben Quiros.
Aye.
Richard's
Thank
trying to
you.
get back on. He sent me a text.
Okay. Next, for vice president, I nominate Bren.
David Dunn seconded it.
Anybody else? Take a roll call vote, please. Mary Lou?
Aye.
Bren?
Aye.
David Dunn?
Aye.
Wallace Dunn?
Aye.
Don Hallmark, aye. Richard Herrera? Ben Quiros.
Aye.
An executive committee member.
I'll nominate Mary Lou Anderson.
Yeah, me too. I'll second that. We'll have a vote. Mary Lou Anderson?
Aye.
Brent Dodd?
Aye.
David Dunn?
Aye.
Wallace Dunn?
Aye.
Don Hallmark, aye. Richard Herrera? And Ben Quiros.
Aye.
Okay, and we're gonna have to do a vote for a secretary, and it's got to be one of you other guys. It will be a formal position, but we're not going to bring. We're not going to nominate one of the folks from the office. It's going to be from the board. This is in our normal set of guidelines and bylaws. So I don't think that there's going to be a lot of extra work involved. You're not going to be expected to take care of all of the stuff. I think we're still going to get that taken care of in the office. but we do need to get someone inside. Instead of nominations, would anybody want to step up? Because you're gonna be a signature on all of this stuff.
David Dunn will step up.
David Dunn will step up.
I
Anybody got a
second.
second? David Dunn and a second. David Dunn and a second. So let's do a roll call vote for that then. Mary Lou Anderson.
Aye.
Bryn Dodd.
Aye.
David Dunn.
Aye.
Wallace Dunn.
Aye.
Don Hallmark, aye. Richard Herrera. Min Quiros.
Aye.
Yeah,
Okay, thank
Rich are
thank
still
you,
trying to
folks.
get on.
Thank you, folks. We will do a good job. We've really come together this year. I thank you for all that y'all have done. All right, now we'll take public comments on any agenda items. If there's anyone on that would like to comment, speak now, forever hold your peace. I don't think I hear anybody. And okay, next we have consent agenda items. You guys have that in your packet to consider. Have you looked that over? And then entertain a motion.
David Dunn makes a motion for approval.
Wallace will second.
David Dunn and Wallace seconds. Mary Lou Anderson on roll call.
Aye.
Bryn Dodd.
Aye.
David Dunn.
Aye.
Wallace Dunn.
Aye.
Don Hallmark's an aye. Richard Herrera. And Ben Quiros.
Aye.
Thank you. And now we'll go to committee reports. Ms. Dodd, Finance Committee.
Hey, the Finance Committee met today at 5 o'clock and considered and approved the financial report for month ended April 30th, 2020, and the consent agenda item that was listed on our agenda. And I would move to approve the Finance Committee report.
David Dunn
Wallace will
seconds.
second.
I have a motion and a second by David Dunn. Mary Lou Anderson.
Aye.
Bryn Dodd.
Aye.
David Dunn.
Aye.
Wallace Dunn.
Aye.
Don Hallmark, aye. Richard Herrera. Ben Quiros.
Aye.
Steve Ewing, you have something for us from the endowment funds.
Yes, every year we make a distribution of funds equal to 10% of the earnings. And the three endowment funds are the Texas Tech University Health Science Center, Permian Basin for the benefit of internal med, family practice, obstetrics, and School of Nursing. And we have a distribution of $57,868.08 that I'd like approval for Odessa Junior College for the benefit of the School of Nursing for $15,869.66. And then for the University of Texas Permian Basin for the benefit of School of Nursing, $13,092.90. This is an annual distribution we do every year. I missed it last month. It normally goes out in the May packet, but we can't distribute the funds until we have the board's approval. So I would ask that the board approve the distribution of these funds to these three endowments.
Any questions or comments on it?
I'd like
I
to
have
make a
a
motion
question.
for approval.
Ben,
Go ahead, Wallace.
Ben gives a motion for approval. I'm looking for a second.
I'll second.
Don, I have a question.
That, so we'll do a roll call vote. Oh, Wallace, you got a question?
Yes.
Yeah,
All right.
did Steve say Odessa Junior College? I just wanted to clarify that.
Yes, I did.
Is that different than Odessa College?
No. Y'all don't make fun of Steve. That's just not right.
I'm just reading what's on the paper.
Okay, I just wanted to clarify because I thought I heard that. Thank you.
Okay. All right. All right. Mary Lou Anderson.
Aye.
Brenda Dodd,
Aye.
David Dunn,
Aye.
Wallace Dunn,
Aye.
Don Hallmark, aye, Richard Herrera, and Ben Quiros.
Aye.
Thank you for that. Mr. Tippin, you got any news for us?
Yes, sir. We have several things under my report. The first one is, believe it or not, it is time to start looking at your calendars to start setting up budget workshops and tax notice dates and things like that. We are working on a timeline for that, and I will send that out to you as soon as it's prepared. We do think we may need a meeting sometime the week of the 17th of June in there to start this process off. I will keep you posted on that, but it's getting to be that time already to start working on next year's budget. So just be aware of that. And as we get ready for those, we'll start sending out requests for dates and make sure we get all that posted and get ready to move forward with that. Any questions about that? All right, on the next one, to discuss the future board meetings. Right now, there is very little guidance on how to move forward back into the open board meetings, especially when you have a crowd over 12 people. As soon as we see that or the governor releases that out, we will then make our move back into our in-person live meetings. But my recommendation to this group is just to stick with the guidelines as long as they're out there. I mean, I think we all kind of miss each other. We're ready for an face-to-face board meeting. At the same time, you know, our board meetings usually have 50 or 60 people in it. And right now, it's just not clear on how you would handle a crowd in an open public meeting over 12 people. And so we will keep our finger on that pulse. And as those come available, we'll get those to y'all. But as we stand right now, we will just stay with how we have it going. And as soon as it opens it back up, we'll start moving back to the in-person.
Hey, Mr. Tippin, it's Wallace. Have we heard on the meetings, I have on my calendar THA at the end of the month? Have we heard anything on that, if it's been canceled?
THT has been canceled.
Russell, you're muted.
Can you hear me now?
Yes,
All those meetings have been canceled.
thank you.
Did you hear that, Bryn?
Yes, sir.
Okay. Any other questions about the board meetings? I'll keep you posted on that, but until we get some clear guidance, we'll just hold the course. And I do think when we get into our budget session, we start approving tax rates, we will probably need to have those face-to-face just so we can make sure that our transparency and the availability of the public to make any comments on that. But as for now, we'll just hold the course.
Hey,
All right.
Russell, on the board workshops or the one that you're wanting to have in June, if y'all could let me know this week, because we're already in June, so I can mark it off on my schedule, because that's only a couple weeks away. I just want to make sure I block it off so I can come or I can participate.
Yes, ma'am. Let me,
Just any time this week. You don't have to tell me like right now, but just
okay,
sometime
We will.
this week so I can mark it off. Thank you.
we will. And this schedule, once we get it finalized, I'll email that out too, so you can kind of see down the road and get those on your calendars. So I'll make sure everybody gets a copy of that. On the COVID-19 update I have on here, the last 2 weeks here have probably been our most significant weeks we've had as far as uptick in patient census in the hospital. We did go 20 days in a row without a patient. And then last weekend, we ended up with 9, I believe, over the weekend. And this weekend, we ended up with 9. So somewhere in those numbers, maybe 1 or 2 off. But our last 2 weekends have been very eventful with COVID positive patients. I think you can directly attribute that to social gatherings such as Mother's Day, probably Memorial Day, Father's Day coming up, 4th of July. So we really are keeping a close eye on that situation. Our crew has done very well, both at the 42nd Street Clinic and in the emergency room, handling these. But between us and our friends down the street today, there's probably close to 20 positives in both of these hospitals, which is the most we've had since the beginning. To keep that in mind, when we first started, the data we were looking at was showing us being around 300. And we rocked along for a long time with 4, 5, 2, 3, and then suddenly it's jumped to 9, and now combined together, it's getting up there. So it's definitely, the Permian Basin is always the last in and the last out of anything. This could very well be the same scenario. I will say, first of all, to our crew, our nurses and housekeepers and phlebotomists and everybody that's on the front line has performed amazingly with this. They've been very patient. They have been very smart with wearing their protective gear and making sure that we have positive or suspected patients headed to the right place. This is not the easiest of circumstances to work in, especially when you think about your families, your babies, or your spouses. And our group has been phenomenal in that. You should be very proud of them and what they've accomplished. Not just because these guys are on here, but Dr. Davenport and Dr. Bidden have been rock stars as well, guiding us through this. We've all had some late night conversations even with Kristen. I'll even say something nice about Kristen since she's not here today, but we've really had some good communications going in all forms and fashions and times of day. And I think that that's been very awesome that our crew has been able to function like that, just to make sure that we're making very good informed decisions. Some of those decisions have been difficult to make, but ultimately not putting patient safety or staff safety at risk has been our number one goal, is to make sure that we stay safe and we're being safe for our community. I'd like to tell you that I think that it's slowing down. I think today that would probably be inaccurate. Just with how these holidays are stacking up, the civil protests that we've been seeing in our communities, those type of scenarios, it is proven that this bug likes groups of people. And so when you have groups of people that stay together, or congregate together for a long period of time, it is showing that it is moving through that. But at the same time, this hospital has done extremely well in being prepared. We have been holding our PPE levels, our personal protective equipment levels. Our groups have been doing great. Cheryl down in supply management has been doing fantastic. All the way to our security guys with Brad and his team. I just can't say enough about how well in this crisis we perform. If you were on for the financial report, you can see that this is probably, what we've experienced is probably the darkest day financially for this healthcare system that it's faced in a long, long, long time. And just for the simple fact that you have service lines that are off 70 and 80%, just speaks to the fact that this crew does what it takes and finds necessary to make sure that we're here tomorrow and the day after that and the day after that. and we stand ready to help this community. Not only this community, but I'm sure you've seen that we've reached out into the region, and we have been the source for the region as far as helping with testing. When there was the outbreak in the Crane Nursing Home, we were the only hospital to respond to our friends in Fort Stockton and Rankin, Monahans. We have been on the front line to make sure those communities were able to make very quick determinations if people were positive or negative. And that's what we're here for. We're the stronghold, we're the center point, and to be able to reach out to those folks and get them good help, good tests, and get those tests turned around. Our lab folks, man, they're running those tests all day and all night long. And that is a huge check mark for this hospital that we've been able to step up and help our partners in the region. And we have received quite a few calls, thank you calls from county judges and sheriffs and other hospitals. But I want to thank you for giving us the leeway to be able to be partners with people in our region. And I just want to tell you guys as a board, thank you for the freedom you've given us to move, the freedom you've given us to make decisions immediately. That has not only saved time and money, but it has saved lives as well. And that's what's most important here, is the lives. The rest of my reports, the regional service report is pretty short just because we've been locked down, and I will save the rest of my comments for executive session unless there's any questions.
Russell, I want to just commend you and the team there at the hospital, because I think it's been obvious to the community that MCH has stepped up and led the way, especially very early on when there was problems with the county and communication. And I just really want to commend all of you guys.
Thank you, sir.
I absolutely think that Russell and his team has absolutely been the leader in everything that's happened in West Texas. And it, even in the meetings, and they run great. The meetings have gone great. I mean, they have just done flawless.
Thank y'all very much.
Anybody got anything else? All right, we're gonna move into the executive session. Meeting held in closed session involving any of the following: consultation with attorney regarding legal matters and legal issues pursuant to section 551.071 of the Texas Government Code, deliberations regarding personal matters pursuant to section 551.074 of the Texas Government Code, and deliberation regarding negotiations for health care services pursuant to section 551.085 of the Texas Government Code. We're in executive session.
What time is it?
The time is 5:55. That must be lucky.
Thanks for the deal on that.